And thank you for joining us for today's webinar, Transforming the Patient Billing Experience Through Payer and Provider Collaboration. My name is Meryl Lee, and I'm part of the webinar team here at OODA Health, and I'll be your host for today's session. A few housekeeping items before we get started. We invite you to submit any questions you have throughout the discussion using the Questions tab located at the top of your screen. If we don't get to your question during the presentation, someone on the OODA Health team will reach out to you directly. I'll go ahead and hand it over to Seth Cohen, CEO and co-founder of OODA Health, who will lead today's discussion. Seth?
Great. Thank you, Marilee. As Marilee said, I'm Seth Cohen. I'm the CEO and co-founder of OODA Health, and I'm delighted to be having this conversation today. Before we begin and I introduce our other speakers, I want to take a moment to recognize that we really appreciate the folks who have chosen to join this call given the current circumstances today with respect to the COVID-19 novel coronavirus. We know it's a trying time, particularly for healthcare practitioners. And frankly, we're even more energized that our mission here is to reduce some of the administrative friction that providers face so that providers can focus on mission critical needs like the ones facing us today. And so first, just want to acknowledge and thank you all for taking the time during these busy weeks. With that, I'll turn it over to Jeff. So Jeff can introduce himself, and then to Steve.
Thanks, Seth. I'm delighted to be joining you for this webinar. Thanks to all of you who've dialed in. My name is Jeff Semenchuk. I'm the Chief Innovation Officer at Blue Shield of California, and really delighted to be partnering with Seth and his team and Steve and his team, and we'll tell you more about that in the moments ahead. At Blue Shield, I think the most important thing I just want to say is we're driven by a mission, our North Star, to create a healthcare system worthy of our family and friends and sustainably affordable. So we'll talk more about this, but we're really focused on addressing the healthcare system as a whole, both from an experience point of view for both members and providers, as well as from addressing the cost point of view. Prior to coming to Blue Shield, I've worked in startups and consulting and also led innovation at companies like Pfizer's Consumer Group and Hyatt Hotels and also Citibank. And I think related to what you'll be hearing us talk about at Citi, we were doing a lot of pioneering work in the area of digital payments. And as Seth, I think, will allude to, there's some nice analogs here about what's happening in financial services that we can start applying in healthcare.
Awesome.
Seth?
Thank you, Jeff. And then to Steve, you want to introduce yourself?
Sure. Good afternoon, everybody. My name is Steve Scharmann. I'm the System Vice President of Revenue Cycle for CommonSpirit Health. For those who have not heard of CommonSpirit, we are a aligned and combined ministry that previously known as Catholic Health Initiative and Dignity Health. About a year ago, just over a year ago now, we aligned to form CommonSpirit. My responsibility, well, CommonSpirit is now in 21 states with over 120 hospitals that we manage the revenue cycle for. As part of the alignment, we have 2 revenue cycle partners that we work with, and so as my role on a day-to-day basis, I manage the former Dignity Health hospitals, 36 hospitals in 3 states, and work to improve efficiency and improve the overall revenue cycle for our hospitals. So thanks for joining us.
Awesome. Great. Well, with that, let's dive in. And we're going to first begin with an overview of the industry problem. And again, please don't hesitate to pose some questions or comments as we go. It will be fun to try to make this webinar a little bit collaborative and conversational as we proceed. But in terms of the industry problem, I have a feeling that many people on this webinar are probably very familiar with patient billing. And it would be typical to see someone like Steve, given his position as a leader in revenue cycle, on the line with a new vendor offering some new approach to patient billing. What we think is a little unique is that Jeff's on the phone. And Jeff, of course, is unique for lots of great reasons, but in particular, his role as a leader at a health plan. And so we're really excited to talk about why we believe there is a uniquely powerful role for a health plan to play in a situation like patient billing that has traditionally been under the auspices of a hospital. So as we go through that, let's first talk about the problem we're looking to solve. And here, from the beginning, you'll see we don't think about the challenges we face with respect to billing as a provider problem per se, but we really look at things in a more system perspective. In other words, we really see payers and providers together locked in a series of vicious cycles, that we call it, that are creating unnecessary expense and delay. And so, for example, providers like Steve lead revenue cycle management operations. It is a perfectly rational and important activity for a hospital system to do because they need to optimize the dollars that they collect with respect to revenue. But of course, payers turn around and invest in payment integrity solutions, which again, a rational set of activities to help ensure that the payers are protecting the dollars that leave their four walls. While these are both important activities in the marketplace, what we've observed is it's often the same set of vendors who are selling solutions to both sides. And in some cases, we have observed there is a bit of an arms race that ensues because each side invests in more revenue cycle management and more payment integrity respectively. And to a certain extent, we keep arming each side and the net reimbursement that is ultimately delivered to the provider is deteriorated, is diminished. And so we are observing that and wondering, are we gaining much by continuing to arm both sides with these models? The second vicious cycle, so to speak, that we think a lot about and frankly is very relevant to the conversation today is around high deductibles. In my prior experience, I worked in prior companies where I really thought of a high deductible as a cost shift from the employer, the plan sponsor, to the employee. But what I've learned in working with provider partners like Steve, that in many cases, the high deductible is a cost shift from the payer to the provider because patients often cannot afford the deductibles that they have. And that results in bad debt that is absorbed by the hospital. When bad debt is absorbed by the hospital, oftentimes providers then need to incorporate that bad debt back into a rate negotiation with the payer. If the payer has to absorb a higher rate from the hospital, that results often in cost shift back to the member, which results in a higher deductible, which results in more bad debt, and around we go. The final vicious cycle I'll point to is one around billing very specifically. And I am sure that many of us on this webinar have thrown away a hospital bill. Don't worry, we won't tell anyone, because we know 3 to 4 more are coming. We have trained consumers to ignore the paperwork we send, which of course fuels even more paperwork. And so these are just a couple examples of some of the vicious cycles that we think we're stuck in, which again are not the payer's fault or the provider's fault per se. It's a set of interactions that we are stuck in. And so as we think about that system problem, what we've learned is that it generates enormous waste in the system. And don't worry, we're not going to spend time educating people on medical trend. I am sure the audience on this call understands medical trend very well. But what we have noted is that medical trend is not really a singular thing. That when you peel back medical trend and separate it between administrative growth and clinical growth, you see very different trajectories. And in fact, if you simply look at the expense related to billing and insurance, so to put simply, the amount of money we spend to move money in the system costs more than we spend on prescription drugs altogether. And so what we are excited about is developing solutions that tackle this waste specifically. And what we've noted is that there is not a payer or a provider or a patient that wants more of this. We don't hear any player in the system saying, let's have more administration or more paperwork here. And so there is opportunities for real win-wins, and we're energized to go after them. Okay, so we could talk about the problems in healthcare all day long. Now let's turn a little bit to our vision as a company at OODA Health. We have aligned with our partners at Blue Shield and at CommonSpirit to build a new approach to payments. And in particular, we have galvanized around a vision for real-time payments, which simply stated is a platform that will settle a bill in full when a patient is discharged from a hospital or leaving a doctor's office. And what we're really excited about that vision is it's an opportunity to eliminate the administrative tail of work that ultimately ensues after every patient encounter today. That tail of work is expensive, it is distracting at best, and it undermines focus on care at worst. And so we are thrilled and honored to have these partners at the table who are committed to this journey with us, and together we are building a path to this real-time vision. So this is a good point for me to take a pause. And let me first turn to Jeff and ask, why does this vision resonate with you, and what was the strategic imperative for your organization to be part of this solution?
Sure, Seth. You know, I mentioned earlier that we're driven by this mission to create a healthcare system that is worthy of our family and friends and sustainably affordable. So there are a couple of parts to this, which really drive why we're so excited about what we're doing together with OODA and CommonSpirit. The first part of that is to create a healthcare system. And Seth, you touched on this. The biggest problems in healthcare right now are systemic. That if any one player tries to attack it, potentially they'll be driven by their own incentives or orthodoxies or operating models. And what we have to do is come at this together and tackle the big problems and solve them together, as opposed to individually or independently. The other part to this is that it's got to be worthy of our family and friends, which means it's got to provide a better experience than what members and providers get today. And then finally, it really has to address this notion of affordability. We have to start attacking the costs in the healthcare system. And we're really excited, not that it exists, but excited about the opportunity to address what we think is one of the biggest cost problems, which is all of this administrative waste and effort and time that it takes just to get paid. And if you think about it, you know, one of the names for us as an insurer or plan is a payer. Part of what we need to do and we need to be good at is making payments for services that are provided by providers and hospital systems. So for us, this is a way to enhance what we do today, to provide a transparent experience for our members, to really take away this opacity that's existed around billing and payments and liability, and what do things really cost and what do I really owe, so to create transparency for our members in that regard and to create a better experience. And then for our provider partners like Steve, to actually reduce their administrative time and cost, to be able to make sure that they get paid in real time or near real time for all of the services that they provide to our members. So it's a part of how we view transforming ourselves as a plan and transforming the industry, and I would say it is absolutely one of our top strategic imperatives.
Yes.
Yeah, so Seth, I would echo. First of all, I know that there's probably a lot of providers on this call, and I think that when you hear a payer such as Jeff talk about improving cost and affordability, there may be some eyebrows raised and maybe some eyes rolled because you hear that from a payer. But I can say unequivocally from Dignity Health's perspective, CommonSpirit Health's perspective, that we truly believe that Blue Shield is serious when they say that. And I think that's the beginning of a good partnership, is when everybody comes with genuine motives to try to fix a problem. I've said in multiple public forums before, and I'll say it today, that if we don't figure this out as an industry, the government probably will and is attempting to do that already. And we all know what happens when the government tries to fix a problem. And so I think that is one of the driving forces why we feel that collaborating with payers is so important. But Seth, specifically to your question, as far as a strategic imperative, in CommonSpirit Health, it's all about access for all and innovation, and trying to remove the unnecessary costs and administrative burdens that are unfortunately passed on to our patients and payers. We have embraced a culture of innovation within CommonSpirit Health. We know that patients can be frustrated. We know that patients have anxiety coming to our facilities because they're in most cases not well and looking to improve their health. And so we don't want to add to that anxiety by providing a confusing financial experience for the patients. We are truly trying to do this to improve the patient experience through more streamlined and through digital channels that we'll talk about a little bit in detail as we go throughout today's session. But again, we know that we could not do it alone. We've been trying as providers to kind of do it alone for many years and maybe even decades. And I think we've made some progress by doing it alone, but we ultimately can't get where we want to go by ourselves. And so we're grateful for the collaboration with our payer partners such as Jeff to kind of think outside the box and think of ways that we can ultimately impact the patient experience.
Great. Thank you. And I just want to reinforce that you noted, Steve, that the motives and the interest here is very sincere. And I just have to reinforce that too. It's been incredibly wonderful to see that, it's great to market these big visions and to have excitement around it in PowerPoint slides, but we've seen it absolutely delivered. So thank you for noting that. There are some great questions coming in, by the way, that I actually think we can start to address as we get into the solution and how it works. So as you can appreciate, this is a bold vision to settle a bill at the point of care. Requires a lot of work. And I want to be the first to acknowledge, even though we are a technology company in Silicon Valley, there is no special technology chip that you just embed in a provider or a payer, flip the switch, and you say, voila, we have real-time payments. There's a lot of work that goes into it. And so what we've been excited about is to chart that path with our partners on the line here and to say, what are the steps that we're going to take in order to get there, right? And so as we now dig into this, one of the reasons we're starting with patient payments as a first step, and it's really important that this is clear, we don't think of ourselves as being in the patient payment business per se. We are in the business of delivering real-time payments, and we think that patient payments is the first place to start because so often, as Steve noted, patients take a very long time to pay their bills if they pay at all. So given the incredible delays and expense involved in collecting from patients, it was a logical place for us to begin as we chart that path to full settlement at the point of care. Okay, so with that, let's talk a little bit more about our patient payment solution. So the first thing we need to do, and this is what we always commit to do whenever we're thinking about the different problems to solve in healthcare, is to start with the patient perspective. When a patient presents at a hospital, and they have an expectation for receiving one service, this is often the one bill, quote unquote, they get for that service. So it's actually someone just noted as a question, can OODA handle episodes or bundles of care? Absolutely. And we think, in fact, the consumer, when they have an expectation of receiving an episode or bundle of care, that is one service they're consuming, but yet they end up getting multiple bills from different providers that are involved in handling that care. And so for us, we know this is a problem for the consumer experience. In a moment when a consumer needs simplicity and clarity, we're giving them anything but. And so that's our starting point and our perspective here. What we know is because this consumer experience is so broken and that we end up overwhelming patients with so much paperwork, we run into the problems that are surfaced on this page, excuse me. So principally, we know that most often 40 to 70% of what patients owe is unpaid when billed. So this is what we would call balance after insurance. So for every dollar that a commercially insured patient owes to a hospital, it is very often that 40 to 70 cents on that dollar never gets paid. Which is, if you think about that, that's an extraordinarily high rate of non-collection. And that has all the downstream consequences we talked about earlier. So of course, when you say a statistic like that, the immediate instinct is to say, oh my gosh, well, this is because healthcare is simply unaffordable and patients cannot pay their bills. But the reality is a little different, in fact. Of course, affordability is a challenge, but we believe strongly it is not the sole driver. And if anything, there are other barriers that are standing in the way. So for example, we have observed that the EOBs, or what are called the explanation of benefits that are issued by the payer, often do not match the bills sent from the provider. So if you think about that, if you're a consumer, if you're a patient, and you're getting a communication from your payer that says that you will owe a certain amount, and that is different from the bill that you get from the provider, that creates a mistrust and a lack of confidence in the information you're getting. And of course, it results from the fact that those communications are not coordinated, right? There's no oversight to ensure that those communications that are going to the member arrive in a consistent manner. So that we know is one major driver of non-payment. Another major driver of non-payment we've seen is that people often pay all or nothing of their bills. In fact, we've seen in certain markets that members of a certain insurance plan, 40% of those members will pay all of their bill, and about 25% of their members will pay none of their bill ever, right? So some are paying all of it, and some never even contribute a penny. And then there's this very slim margin in between. And what we've learned is that the people who never pay any of their bills really could benefit from financing options such as payment plans to help them bridge cash flow considerations. And the final one of the many barriers, that just one we'll mention and leave here, is that we have seen orphan bills, what we call orphan bills, go unpaid. So what does that mean? So oftentimes there is a small balance owed by a patient, and we've seen that there's a spike in non-payment of bills under $30. And then for us, what we learned is that that's not really about affordability as it is about convenience. People just don't want to go through the trouble of finding a check and an envelope and a stamp for a bill at $7. By the way, there was a question on where the 40% to 70% number is coming from. I'm happy to send some information afterwards, but it's a combination of industry research. So McKinsey & Company has reported on this, the advisory board as well, and it's been validated by the providers that we work with. So provider partners share with us what collection rates are, and at the hospital health system level, this is a very typical range. Thank you for asking. Okay, so of course, it's not just a bad debt issue, but the member experience issue is becoming more and more painful. And what we're seeing is across the country, members are often subject to collection tactics that are aggressive and in some cases abusive, right? And this is a function of hospitals feeling increasingly desperate to collect the money that is owed to them, but then the challenge in employing aggressive collection tactics because of the PR risk, right? And so across the country, there is one headline after another talking about the challenges that hospitals face and frankly, the circumstances that patients suffer as a result. And I am pretty confident there is no hospital that wants to be in a headline for this type of content. So when we take all this together, we've rethought the problem and asked ourselves, well, if we were truly to drive a billing solution from a member-centric point of view, what would be in the best interest of a member or frankly a patient? And Jeff previewed it. Jeff pointed out that the payer is a payer, right? And is in the business of underwriting financial risk and has a financial relationship with the member. And so when we reflect on that, we think it is absolutely in the best interest of the payer to own and manage the patient financial experience, and that providers like Dignity should be in the business of practicing care. And the example that I use is frankly from our everyday consumer lives. If we all, after this webinar, got together for a large dinner party, the restaurant would not employ a collection agency behind the kitchen to chase us for our bill 1 month after our meal. Frankly, as you reflect on that, you'd probably agree that sounds absurd. And layer on top of that, then imagine in that scenario, it's not just the restaurant sending us a bill, but the salad vendor sends us a bill, and then the beverage vendor, and then the entree vendor, and then the dessert vendor. And we have now all of these bills in front of us. Again, while it sounds absurd, that is healthcare. And I don't know any other industry that we interact with as consumers that have been put in the position of having to build a financial services and collections business. Only in healthcare do we impose these burdens. And I also have yet to hear a perspective that can explain why we've chosen to make healthcare this unique model and why it certainly makes sense for the patient. So what we're really excited about in working through these partnerships is to relieve hospitals of this burden, enable them to focus on the delivery of care, which is as mission critical as ever before, and to empower the payer to own the member experience that they care so much about and to reinforce the financial relationship with those members. So there's a lot to say about why this makes sense for the payer, why this makes sense for the provider, why it makes sense for the patient. But let me take a moment to explain a little bit more about how the model works. So first, let's just start with the patient experience. So what you're seeing on this page is a hypothetical insurance company logo, mountain-based insurance. You can imagine it says Blue Shield of California. As an aside, we have a large office in Salt Lake City, so we are passionate about mountain landscapes. And in this case, imagine this is the payer-branded bill. So instead of getting a provider bill, which frankly could end up being 4 provider bills, instead of getting that hospital bill and the professional bill and the lab bill and the anesthesiologist bill and the physical therapist bill, right, all of which could get piled up with the member, and then having all these EOBs come in addition to those provider bills, rather than all of that, imagine that you now get one single credit card-like statement branded as your payer that says, this is all of the claims, these are all the bills that you owe, all built in here. And you have one consistent experience to handle and manage these payments. And so this on the right-hand side of the page is the patient view. In terms of mechanics, there's a 3-step process to setting this up. The first thing we do is we establish a rate for the provider for what they'll get reimbursed so that we can take them out of the business of collections. So again, today, right, or I should say, in the old model, right, Steve and his team were responsible for pursuing patients for the balances that they owe. And so what we're saying in this model is we want to relieve Steve and his team from that responsibility. So what we ask in our early partnerships is, well, what has CommonSpirit collected historically for commercially insured patients with Blue Shield? And let's guarantee that rate to Steve and his team, because we want CommonSpirit to be as well off as they've ever been when it comes to collections. So if hypothetically it's 50 cents on the dollar that they've collected historically, we guarantee them now 50 cents going forward. The next step is we set this up with Blue Shield. And I want to be clear, we do not interfere with any of the claim adjudication or billing and coding work that either the provider or payer does. We are a customer of those operations. So we wait for the claim to get adjudicated, right? So whenever CommonSpirit submits the bill, Blue Shield adjudicates the bill, we will then receive a copy of that, and that will inform us what the patient balance is and what the payer payment is. And so if we were to take a hypothetical example and say that CommonSpirit billed for a patient service and the allowed amount is $1,000, typically CommonSpirit would receive an $800 payment for the planned portion, and they would be told that $200 is collectible from the patient. In our model, we are now paying the $800 from Blue Shield, and we are contributing an additional $100 that reflects the 50% guarantee rate to CommonSpirit. CommonSpirit then writes off the remainder of that balance. They suppress any collection or communication activity with respect to billing. And now we at OODA consolidate the various balances the patient owes from different providers and puts it underneath one consolidated bill, and we engage the patient for the $200 that they owe. And so in this model, we're able to do this and set this up across multiple providers. So as we set it up with CommonSpirit, we can set it up with the outsourced emergency department, the lab provider, the anesthesiologist, establish the guarantee rates with each of them, make sure that they get the benefit of whatever they've historically collected, remove any collections or communication activity through them, and reinforce everything now through the payer. Great. So there were a couple of questions. I'll just take a moment to just pause for a second and share. I can answer some of these and we can come to a couple others as we go forward. There was a question on, can we handle episodes or bundles of care? Absolutely we can, because again, as long as the payer and provider have set up that arrangement and the payer is adjudicating that, then we are a customer of that process. So at the end, we are just simply told whatever is the patient balance, and then we administer this process at the end of it. There was another question on which business segments is this partnership live on? We started with fully insured business and ACA, and while we are moving to include Medicare Advantage and ASO. So it is the intention of the partnership to have all lines of business covered. So with that, I'm going to turn it over to Jeff to share a little bit of the results that we're seeing so far.
Thanks, Seth. I mean, the headline is our members and CommonSpirit patients love this. Still a little bit early days in our pilots and experiments, but what we're seeing is really, really remarkable. So you'll see 93% positive member satisfaction, which is crazy. A, for healthcare, B, for billing or payments. So to see this sort of satisfaction level from our members and patients related to healthcare billing is really staggering to us. And then you'll see some of the verbatims here just about you're making this so painless and easy. I typically am overwhelmed with all my medical bills, and this is helpful. Now we just get the one bill from the insurance company. So you'll see this is thematically now aligned with our hypotheses for this, which is if we can simplify this experience for our members and patients, it is more likely that they'll pay more completely, they'll pay more quickly. You'll see some results on that in a bit. So we're really encouraged by this, and I'll just go back to the analogy that Seth put out there around sort of all of us going out to eat and even more other retail shopping experiences. It now makes sense if consumers are so used to having one payment card, say a credit card, a Citibank issued MasterCard. I use that to settle everything, and then I get this monthly statement. And all of my purchases have already been settled for me by Citibank and MasterCard. And then I decide every month how much of that total bill I'm going to pay. Am I going to pay it all off? Am I going to pay it off over time? But it's simplified. And I think that's the real power of what we're seeing now with what we're doing here, that members, to Seth's point, many members are actually happy to pay, but because we've created such a fragmented system, they're not sure what to pay and when to pay it. So it really simplifies it. And the results so far coming back from our members and patients have been really, really encouraging.
Hey, Jeff, this is Steve. I just wanted to interject something, too. Something that Seth said earlier about the EOB and the statements not matching or the bills from the providers. And I think that while hopefully most of the time the balances probably match, oftentimes the verbiage or the nomenclature doesn't match. As you know, as most of us on this call know from a provider setting, we may summarize a bill, we might itemize it. I mean, everything looks a little bit different, and for a specific episode of care, like an emergency room visit, and multiple providers sending a statement to the patient, the likelihood of those statements matching exactly with the verbiage that is on the EOB from the payer is pretty slim and very unlikely. And I think one of the great things that we've been able, and I think we stumbled across this really in our pilot, is that we've been able to match the statement that is sent to the patient with the same verbiage that is on the EOB that the patient gets from the payer as well. And so it's easier for them to match up. Oh, okay, Blue Shield says I have a $500 deductible for this ER visit or what have you, and then they can see the statement says the same thing. And I think that's really been a great benefit of this collaboration.
Yeah, absolutely right, Steve. That's been I like the way you built on that it's one of the learnings we came to together about how we can be better aligned on this.
Yeah, awesome. And in addition, one thing, Jeff, is you talked about the member experience. I realized I neglected to mention, but someone asked about on the chat line is, do we offer payment plans and what are the fees or interest on it? And one thing I'm very proud of is in the spirit of this and the fact that we are so committed to member experience, that we are offering 0% payment plans, no fees, no interest rates to all members with bills of $50. And we are delighted by that and very proud of it. It's one of the things that members are responding most positively to. And so I meant to point that out as well. And what's really exciting about this model is as we build this credit card-like experience, as Jeff mentioned, now a patient can have a payment plan that extends across multiple providers. So rather than having a payment plan with a facility and then a separate professional plan, you can now have one that you are working on, focused on across different provider settings. Great. So in addition to the
Seth,
yeah, please.
Seth, I'll just quickly build on that too. To this notion of is it an affordability or a cost or confusion thing? think, Seth, you've mentioned, and the data is starting to reinforce this. Many patients, many members are actually quite willing to pay. It's just we've made it complicated. So that's something that we're proving out in this pilot. But of course, there are some patients, members who have challenges paying all of their bills in real time. And so, Seth, to your point, we're really delighted that for those, there's an ability to spread this out. So sometimes affordability is sort of absolute dollars in my monthly budget or, household wallet. Other times it's just about sort of cash flow. Like I'll have it, I just can't pay it all now, and we just need to spread it out over time. So I think that's been a really effective component of this as well.
Yeah, and we hear that from patients. Absolutely. And so we are most proud of the patient experience. I think it's very unusual to get anyone to respond positively about a billing experience, let alone 93% of people saying that they are happy about the medical billing experience they've had. I'd argue that that's really rare to find in any billing solution. So we're very proud of that, and that is the most important priority of the program. With that said, we're also really pleased with some other metrics that we'll share as well. So first is this idea of member engagement. So what does that mean? That means for anyone who has received a bill from us, 75% of those recipients have responded to us in some way. Either they have wrote us a check, they've called us, they've logged onto our digital app. And we think of that as engagement because as we're going to talk about in a moment, and Jeff's going to speak to this, we have a vision for thinking about billing as more than just a mechanism to collect payment, but also as a channel to communicate with members. And I'm not going to steal Jeff's thunder there in a moment, but we'll talk more about what that means. The other thing, of course, we're very proud of is the financial sustainability of the program. We are tracking very closely, of course, how our collections rates compare to the current provider experience. And what we've been delighted to demonstrate is that when it typically takes the amount that a CommonSpirit or other providers would collect over 12 months, we're on track to collect within 4 to 5 months. And again, I think that speaks to the power of consolidating various bills into one place and leveraging the payer brand because members have an ongoing relationship with the payer and associate them with the financial experience they're having. So we're really proud to be able to demonstrate that not only can we deliver an outstanding member experience, but that we are collecting at a faster pace than is a typical provider baseline. And as a result of this success, I'm also thrilled to point out that we are rapidly growing our facility and physician group adoption. As you can see in the chart on the right, we launched our very first pilot in April of last year, and we slowly gathered additional, we gathered additional adoptions from other hospitals, first in the Arizona market and now in California. And in the past couple months, we've seen a very rapid scaling of the platform. And we're thrilled to now have so many facilities and physician groups onboarded, and so that of course really helps deliver the very consistent patient experience that we're after. So let me pause here for a question. And Steve, you touched on this a little bit before, but why do you care about patient experience as a revenue cycle leader? And what is the connection between that and your overall collection strategy?
Well, so Seth, we all recognize that patients have the ability to, in most cases, have the ability to choose where they want to go. And I realize they often are driven by what's within their network. But we at CommonSpirit want to build loyalty from our patients. And obviously, one of the biggest driving forces with that is the quality of care that they get. But for years, I've harped to my revenue cycle staff that a patient could come into our facilities and have a great experience, and then we could mess up the billing experience and mess that up, and that leaves a sour taste in their mouth. I think we have to recognize as revenue cycle leaders that we have contributed to the confusion and the anxiety that a patient feels in the infamous healthcare billing world. It's obviously not on purpose. We don't intend to say how can we drive this person crazy, but it's sort of with the industry that we have and the kind of the restaurant analogy that you used. It's the world we live in, and we are somewhat of a contributor to that confusion. And unless you're in a health system that is completely closed, where the facility and all the physicians that practice in your facility and all the providers that practice in those facilities are employed and are billed under a single system, then we create that confusion and that frustration. And so, for CommonSpirit Health, we've tried to look for an opportunity to fix that. I like the idea that our CommonSpirit Health patients can come to our hospitals for their care. That's it. We are their healthcare providers. We're not a debt collector in this program. We're not the people that are going to call them and try to set up a payment plan, or, heaven forbid, ultimately send them to bad debt or a collection agency and affect their life that way. That's not what our vision is about. That's not what we want to be. And so we're grateful for this opportunity to partner with payers to work on that. In addition, with this partnership, as we've mentioned before, they can also enjoy the clarity and simplicity of receiving a single bill rather than multiple bills from multiple providers. And we think there's a lot of mileage that we can get with that. Now, I don't want to sit here this afternoon and be all kumbaya on patient experience. That's a very important role for us, or important part for us in CommonSpirit, but I'm a revenue cycle guy. And the bottom line is also very important. We've all heard well, I won't say it. Never mind. I won't say it. But we're happy to also have faster realization of collections. Through our pilot, and this is not an over exaggeration, when we send a claim to Blue Shield, and it goes through this process that Seth described, where we send the claim just as we normally did, we actually get payment, both the what I call the insurance portion of the payment and the patient portion of the payment, sometimes within 10 days. And that's unheard of in our experience. That especially if there's a patient liability, that liability is going to be out there for 30, 60, maybe a year if they're on a payment plan. And so from a revenue cycle perspective, to have those claims adjudicated fully and at zero balance within 30 days of sending the claim is something that I don't know that I thought I'd ever see in my career. And then I guess ultimately it takes us out of the business, as I mentioned before, takes us out of the business of patient collections, and it allows us to dedicate the resources that we were expending on collections and put those back into direct patient care. And that's what we want to be known as at CommonSpirit.
Seth?
Yes.
I just want to build one thing too, Steve, on what you said too. I mean, one of the things that I think I just want to briefly point out is both CommonSpirit and Blue Shield of California are not-for-profit. And so I just want to get a little bit to sort of our motivation and incentives. And I know, this has to work across for-profit plans and the whole bit. But, we are not driven by an incentive of holding float, right, Steve, to your point, to hold cash for 4 months just so we get the float on that, right? We want to make sure that we're trying to address the overall operating costs of this system. And so for us, I think we're fortunate in that, there have been a few commentaries at the end of primaries and debates about greedy insurance companies. I can say, at least for our case, we're not, because we're not driven by high profits and margins. And so this particularly works for us in CommonSpirit because we're able to just create much more efficiency in this, let's call it marketplace that works to the advantage of everyone.
Awesome. And Jeff, as you talked about your role as a nonprofit, that's a good segue to another part of this, which is the financial relationship with the members. And, as you noted in the beginning, it's natural for you to be in the billing business. But we are excited to explore a little bit more of the details here and how you think about that implication, right? There's a couple questions that have come through and asking, well, is the payer absorbing the patient liability here? Are you guys underwriting the risk of collections? Are you not? And so maybe talk a little bit about
Sure.
yeah, what we're doing today, how you think about it, how other payers might think about it, because that is coming up a bit in some of these questions here.
Yeah, so I'll address that in two parts. One, sort of our role as a payer and sort of in this broader financial experience for our members and patients, and then secondly, sort of the underwriting and taking on the liability and the risk for this. So, you know, one of the things we're really learning through this is that from our members and CommonSpirit's patients' point of view, this all begins with the plan and the coverage that I have. You know, if you like, the benefits that I get as a part of this, you know, whatever insurance plan that I pick. And so that comes when I first select a plan, whether I'm paying for that myself as an independent or for my family or a small business, or whether I'm choosing a plan as an employee and my company is providing this. In most cases, I still have some portion of the premium that I have to pay. So the relationship starts there, that the financial aspect of this starts and continues through the plan that I select and the coverage that I get. And I think what's happened historically is payers, insurance plans or whatever, you know, maybe consciously, maybe unconsciously, we sort of then let that go so that it becomes more and more fragmented, and the responsibility of a patient or a member to figure out their total financial picture. And so one of the things we're finding through this pilot, and you saw it again in the verbatims, is that our members are saying, you know, this is awesome because you are now bringing this all together in one place. I'm not responsible for managing all of these different expenses and costs across all these different services. So we really are finding that from a member's point of view, this is one of those cases I think of in disruptive innovation. It's hard for a user to articulate what their needs are or what they'd like because they've been so conditioned by the prevailing industry norms that this could never be possible. But now that they're experiencing this idea of sort of a single statement, it just kind of makes sense, you know, like this is the way it should have worked all along. So that's why we're encouraged that it really does make sense that there's sort of more of the holistic financial relationship with the payer. And then with respect to the mechanics of this, for the pilot, we are underwriting the member liability. So Blue Shield is doing that. So when OODA makes a payment to CommonSpirit on our behalf for the member portion or their patient portion, that's coming from Blue Shield. Going forward, and part of what we're using the pilot to do is to really understand the dynamics of payments, repayments, risk, liability, and then to make a call on that. You know, we have a strong balance sheet that we could put to use for this. One of the things we're going to wrestle with is, in fact, whether we do that. So there are other opportunities for other players to take on this member liability. And that's something we're going to explore going forward. And Seth, I know you're also looking at multiple options as well for OODA.
Yes, that's right. Wonderful. Let's move on to the partnership itself. And so Jeff and Steve, what are you most proud of with our collaboration and what we delivered? And Steve, why don't we start with you first?
Yeah, I think I mentioned it a little bit before, Seth, but I'm really proud of the open and honest collaboration we've had between Blue Shield and ourselves. You know, that generally and historically doesn't exist between payer and provider. Everybody is out for the bottom line, what's the return on investment, so on and so forth. And while we can't lose sight of that, we all have financial responsibility to our organizations. What has been refreshing in this pilot for us is that we both have kind of come together with the patient in mind. And I go back to my original comments. If we don't do that as an industry, then the government's going to try to do that and probably mess it up. So I'm probably most proud of that collaboration of the openness and honesty that we've been able to share. I believe the feedback that Jeff talked about earlier from our patients is really validating that. And this is not just maybe just to point out, Seth, you guys to the patients offer kind of a postpartum interview to every one of them. It's not, we don't pick and choose maybe the ones that are going to give us the best comments and kind of the sound bites. Everybody has an opportunity to tell us what they think, and through those interviews, we have seen an overwhelmingly positive response to this, and so that's very encouraging for us.
Great, thank you. Jeff, anything you want to add?
Well, I'd say the same thing. It's really about trust and collaboration and partnership with Steve, Seth, with you and your respective teams. And I would say again, this is very sort of on the scale of innovation, everything from incremental sort of small stuff to big disruptive stuff. This is pretty disruptive, and it disrupts a lot of how the industry has played historically. And I think going into this, I'll be candid, we all were sort of dancing around each other a little bit. Well, how's this going to work? And who's going to do what? And we're not going to share that. And we want this, and maybe you're not comfortable sharing it with us, data, that sort of a thing. And so I think it was really about the ability to go into this, to know that we're doing this on behalf of our patients and members, behalf of our business partners, to really make it better and to transform it. And that's exactly what's happened. And Seth, you and your team have been instrumental at that. You did not come into this with arrogance to say we have it all solved, just listen to us. You have big, bold ideas, and you've also listened and learned and rolled up your sleeves and have adapted. And I think that's what it takes, particularly in these early stages of really transformational innovation.
Okay, thank you. So briefly, I'm keeping track of the time here. Why don't we do, and you mentioned a little bit of the dance, Jeff, but maybe you can start within some of the challenges and lessons learned, and then we'll move to kind of where we're looking forward and see if we have some time for questions. Jeff, you want to start on lessons?
Yeah, sure. And I'll just focus on some of the lessons learned, and as challenging as this was to do, let's say externally in partnership with CommonSpirit and OODA, it took us a while to get aligned internally for this. We have a lot of people who have been doing their work the same way for a lot of years, and it works, and they're comfortable in it. And this really disrupted a lot of operating models, processes, jobs, to be candid with you, as we automate this. And so it took just a little time. And especially because we were going early, there wasn't a lot yet to show by way of evidence that this works. I think going forward, for those of you on this call, it's going to be easier now because it's in there, it's in market, it's working, there's good evidence. But even still, I think this is a real challenge to mindsets and traditional roles within our company for sure. So I'm really, really proud of how our team has come together. We have some amazing leaders on this: Shana Schultz, Pradeep Kimani, Denise McKenna, just to name three of many. And it takes really great, strong leadership to make something like this happen.
Steve.
So Seth, for us on the challenges, I'll just add a little bit. I think Jeff talked about what I would call kind of a true paradigm shift in the healthcare industry. You no longer, at least in this arrangement, can a patient come into the hospital with a statement and say, where do I make my payment? That balance is now due from Blue Shield of California, or due to Blue Shield of California. And so while the technical part of it for us was not very difficult, we leveraged existing communication channels, if you will, with the payer. We through our clearinghouses, we still submit the 837. We get an 835 back or two 835s back from Blue Shield, one with the insurance payment, one with the patient liability. All of that we leveraged, and so it was very, very simple from a technological perspective. To me, it was the training of personnel within my revenue cycle, whether it's on the front end or the back end, to help the patient realize if they do call us, and again, it's training the patient too, I want to make that $500 payment, we can't just simply say, oh, your balance is zero, congratulations, go use that $500 on your car payment. We have to recognize that that balance still may be owed to somebody, just not to us as a provider. And so that was the biggest challenge for us, is just making sure everybody understood the program.
Yeah, that's great. Wonderful. So to our final section / question here, where we're going. And Jeff, I would love to turn it to you to just give a brief glimpse on what we're looking ahead to as we build on our early success. So let me turn to your favorite slide.
You bet.
And take it away.
You bet. And so, Seth, you've really teed this up that what we need to be looking at here is how consumers experience everyday life in and through other brands and industries. And so this idea of using a credit card, in this case, the example of an American Express statement, is really pointing us, I think, in the direction we need to go to equip consumers, members, patients to really be in charge of their health care, and then to provide them ways and tools really for how to do that. And so we're really excited that within this notion of sort of broadening the financial relationship with members, it can extend to premiums. So if I'm going to pay my monthly premium, maybe I do this through this same platform. And then, and probably there are some companies that do this better than others. But in the case where companies actually have other offerings and services for us that are really beneficial to me, we see this platform as an opportunity to do that. So we're at Blue Shield expanding into, I'd say, much more holistic health sorts of services and coverages, not just pure medical ones. We're really focusing on prevention. We're looking at things like, broadly speaking, the social determinants of care. We know that issues like housing and food and transportation and education have a fundamental impact on people's health and well-being. So we anticipate that this, if you like, broadly speaking, monthly payment platform can also be a way that we can start making these much more available and easier for our members and patients to access over time.
Great. Great. Well, I'm noticing the time. Thank you, Jeff, for that. And we are really excited for what we've accomplished today and what we're building. I'll just note there was a number of questions. I think our team has been able to answer most of them, and we've addressed most as we've gone. There was one last question we didn't touch on, which is the cash flow implications for the payer. And again, as Jeff noted, some payers are going to take different views on how to think about underwriting and risk. But that is something that the payer has been willing to leverage their balance sheet to help relieve providers of this burden. And so that's been one of the benefits of the program. So I think at this point, let me see if there's just other questions. There was one other question about the role of clinical data that patients might have access to. In this program, we are not accessing clinical data. This is purely on the administrative and financial side. So that hasn't been something that we've needed to be worried about. So with that, I'm going to go ahead and first thank Jeff and Steve for taking time out of their very busy schedules to join us and speak to the work that we've accomplished today. Again, I'm incredibly grateful to this partnership and really excited for what's ahead. So thank you all for joining.
Thank you, Seth. Thanks all. Thanks, Steve.
Yeah, thank you, everybody.
And thank you, everyone, for attending. We hope you enjoyed today's presentation, and we look forward to hosting another one in the future. Thanks so much.